Mr. Demske, you're recognized for 5 minutes.
Good morning, Chairman Murphy, Ranking Member DeGette, members of the subcommittee. I'm Greg Demske, Chief Counsel to the Inspector General at the Department of Health and Human Services. I appreciate the opportunity to appear before you today to discuss the Federal Select Agent Program. While CDC administers the Select Agent Program with the Department of Agriculture, OIG is authorized to impose civil money penalties for violations of the regulations. We also audit, evaluate, and offer suggestions for program improvement. CDC reviews all potential Select Agent violations and immediately refers urgent or criminal matters to the FBI. In other matters, CDC further investigates and determines whether to exercise its authority to suspend or revoke a registration or require remedial actions. If CDC concludes a civil violation may have occurred, it refers the case to OIG for potential enforcement. OIG carefully evaluates every referral and decides whether to pursue the case and what penalty to seek based on the facts and circumstances of the particular case. In our experience, violations of the regulations pose varying risks to public health and safety. To date, OIG has imposed 20 CMPs totaling $2.4 million for Select Agent violations. 2 of our cases have involved Dugway. In April 2007, Dugway shipped anthrax to a research facility. The shipment included a certification that the anthrax was non-viable. The research facility tested the material and found the presence of a low concentration of viable anthrax. We found that Dugway ignored the results of its post-inactivation viability test, which showed viable anthrax was present. Later, in November 2010, a government laboratory received a shipment from Dugway that included a vial of botulinum neurotoxin. Small amounts of this Select Agent are exempt from the regulations. The packing slip indicated that the vial contained an exempt amount, but in fact the shipment included a regulated amount. Dugway then self-reported 2 other unauthorized shipments of this Select Agent. As a federal entity, Dugway presents an enforcement challenge for OIG. Any CMP on a federal entity would simply shift money within the government at a net cost to taxpayers and may not promote better compliance. Consistent with our approach to date with other federal entities, OIG issued notice of violation letters to Dugway for both cases. Both letters stated that OIG had determined Dugway violated the Select Agent regulations and it should examine its current policies and practices, take corrective action, and monitor its safeguards on an ongoing basis. Yesterday, OIG received another referral from CDC on Dugway. We are reviewing the matter now. Over the years, OIG has audited government and private entities for Select Agent compliance. For example, OIG audited 6 federal laboratories and provided audit results to the heads of the relevant federal agencies, putting them on notice of deficiencies. OIG is expanding our audits and evaluations of Select Agent management. We will focus on CDC's oversight of the Select Agent program and on the operation of HHS laboratories that handle Select Agents. Through our enforcement work, OIG has also identified several opportunities to improve program compliance, oversight, and enforcement. As reflected in my written testimony, these opportunities focus on enhanced documentation requirements and increased authority for CDC inspectors. We stand ready to work with CDC and others in HHS to continue to improve the Select Agent program, use our enforcement tools to promote compliance with these regulations that protect the health and safety of the American people. Thank you again for inviting me to speak. I'd be happy to answer questions.
Thank you, Mr. Demske.